Hello, good morning. This is so we are in the webinar of antimicrobial resistance. I'm supposed to do on infection control. So my topic is the importance of adhering to infection control measures in the battle against antimicrobial resistance. I'm Dr. Bhagya PSC, consultant microbiologist from Teaching Hospital, Karapitiya. Right. So what is antimicrobial resistance? What are the causes? So one thing is, you all know what is antibiotic resistance, right? And when a bug develops resistance to an antibiotic, we call it antibiotic resistance or antimicrobial resistance. So this one thing is overprescribing of antibiotics, or patients not taking antibiotics as prescribed, or unnecessary antibiotics used in agriculture or aquariums or in fishery or as growth promoters. And most importantly, poor infection control in hospitals and clinics, and poor hand hygiene. Poor hygiene and sanitation practices would be the causes for antibiotic resistance, and also lack of rapid laboratory tests to differentiate between viral and bacterial infections. So even for viral infections, people prescribe antibiotics. So it will be overused and causing antibiotic resistance. What is the global impact of antimicrobial resistance on human health? So it says 700,000 antimicrobial resistance related deaths per year globally happening. And only 30% of developing countries to have a national action plan on AMR. And they say by 2050, there will be $100.2 trillion US lost to world due to antimicrobial resistance. And the other figures are as well. For an example, 58,000 newborns die, and 490,000 new cases of multi-drug-resistant TB per year, likewise. So it's a huge impact on the global economy and on the human health. So sepsis by multi-drug-resistant organisms, you all know, extremely difficult to treat, costly, and definitive antibiotics will be there but difficult to find, and availability is not always, and they have a lot of adverse reactions. Toxicity of drugs are high, and when the patients are in the hospital for antimicrobial, the resistant infections, they will get more and more secondary infections because of the longer hospital stay, and there will be high rates due to immunosuppression, and there will be huge family issues and economic loss to the country. So how can infection prevention and control help in combating AMR? One thing is it reduces colonization by resistant organisms, and secondly, it prevents occurrence of multi-drug-resistant infections, and thirdly, it prevents spread of multi-drug-resistant infections among the population. How? Well, one thing is surveillance of multi-drug-resistant occurrence or hospital-acquired infections in the healthcare setting. This is very important to predict the outbreaks or to detect the outbreaks early and to know our figures exactly. And infection control is the policymaker on hand hygiene, aseptic procedures, decolonization, isolation, sterilization and disinfection, cleaning, waste management, and all that. And also, in the infection control setup, we review these policies, we update them, and we monitor the compliance or adherence, the adherence to these policies. And as I said, outbreak investigations and control are coming under infection control, and also continuous education and raising awareness are also important. So what is important in routine practice? Most importantly, hand hygiene and standard personal protective equipment. I'll come to that. and aseptic procedures for blood drawing, catheterization, and wound management. Follow-up of patients with multi-drug-resistant infections and referring them to tertiary care facilities when necessary. Decolonization in MRSA cases, and also education on personal hygiene and hand hygiene. So all these things can be practiced in your setup. What is hand hygiene? The most effective way of preventing spread of infections, especially in the healthcare, associated infections. So you can see this figure, the hand imprint on a blood agar plate. It shows how much colonies, how many colonies are there on the hands. All these are staph and strep and all that. So all these can be reduced. The bioburden can be reduced by hand hygiene, proper hand hygiene. And this book, the illustration was taken from the WHO booklet the WHO book on hand hygiene. So you can see how a healthcare worker transmits bugs from one patient to another patient, from patient A to patient B. And also, the catheters and the other devices may be colonized. There will be surface colonization with a lot of bacteria. And if you touch them and if you then touch the patient without hand hygiene, you will be transmitting all the surface bugs to the patient. And they could be MDR. So hand hygiene. For you to have good hand hygiene, you have to fulfill several things. One thing is when to do. When to do means decided by the WHO recommendation on 5 moments of hand hygiene. There are 2 befores and 3 afters. So 2 befores comes before patient contact and before aseptic procedure. 3 after comes after patient contact, after exposure to blood products and body fluids, and after touching the patient's surroundings. So all that 5 moments, you should practice hand hygiene. Now, how to do? That should be decided by the 6 steps technique recommended by the WHO. So you can see this figure. Palm on palm, back of the palms, interlaced fingers, cup fingers, and fingertips, and your thumb. And if you want, you can include the 7th step as wrist. So all the surfaces should be covered for you to have good hand hygiene. With what? Alcohol or soap and water? Could be alcohol. So for brief touching, if your hands are not soiled, it could be alcohol. If your hands are visibly soiled, then you have to go for soap and water. How long? With alcohol, it should be minimum of 20 seconds. With soap and water, the WHO recommendation is to have 40 to 60 seconds hand washing. But for the practical purposes, we have reduced up to 30 seconds, but you have to do it perfectly. Plus, hand drying after washing with soap and water. This is very important. What about gloves? Aren't they replacing hand hygiene? Absolutely not, because the gloves can have micro pores. The secretions and excretions can go here and there through the pores with the bugs. Standard PP. The minimum PP you need to have in your practice are masks, gloves, shield, gown, or apron. So it's completely all right for you to go bare hand in between patients as far as your hands are clean, hands are the hygiene with alcohol or soap and water. So hand hygiene over the gloves, maybe, but not recommended really. It's better, the recommended practice is to change gloves in between patients. But in high-risk setup, if the frequent glove changing is really impractical, not practical, then if you are sure that your gloves are not soiled, then you can practice your hand hygiene, alcohol hand hygiene over the gloves. Aseptic procedures, that is proper skin antisepsis sterile procedures, and hand hygiene are most important. The skin antisepsis is very important in blood drawing, cannulation, catheterization, and wound management. And you have to wash your hands before. Blood drawing, cannulation. How to do skin antisepsis? The inside must be properly cleaned, clean with alcohol over and around the selected site, and allow to dry. Wait for 30 seconds to kill the bugs on the site, and then clean with 10% povidone iodine in a concentric fashion from the center to periphery. Allow at least 1 minute to act. How much good is the antiseptic? You need to give time for the antiseptic to kill the bugs at the site. Otherwise, your sample will be contaminated, you will be introducing organisms to the site, and the patient will develop phlebitis and subsequent cannula site infections. So all that problems come. So, and the very important part is taking care of patients. The following up of patients with MDR infections. For an example, recurrent UTI, urinary tract infections, or skin abscesses. You have to look for the source and nature of the infection. And you may take cultures to identify the bug and give proper treatment. You need to see in the recurrent Staphylococcus infections, you need to see, especially in MRSA, you need to see whether they are carriers, whether the carrier status has predisposed to recurrent infections. So you need to screen for carrier status, and if the carrier status is positive, then you need to decolonize. If necessary, you can refer them to tertiary care facilities. And also you have to educate them on personal hygiene and precautions to avoid spread within the household, not to share personal items like towels, right? And razors, brushes, and hair brushes, and all, and good personal hygiene. How to do MRSA decolonization? For the decolonization can be done for infected patients and for patients awaiting major operations and procedures. The duration of regime of decolonization is for 5 days. And if decolonization fails in 3 of patients, you have to refer to the microbiologist. You have to do nasal and skin decolonization both. How to do? Nasal, you have to apply mupirocin 2% nasal ointment to the inner surface of the anterior nares 2 to 3 times per day. A match head size portion to be applied to each nostril using a disposable cotton swab. Patient should be able to taste mupirocin at the back of the throat after application. And this is for 5 days consecutive. Skin. The patient should have daily baths with 4% chlorhexidine solution or 7.5% povidone iodine. What we recommend most is 4% chlorhexidine, which is convenient for the patient and for the skin. Apply the antiseptic thoroughly after moistening the skin with water, then rinse with water. Pay special attention to the known carried sites like axillae, groin, and perineum. On first day and the 3rd day and on the 5th day, that means every other day, you have to wash your hair with 4% chlorhexidine followed by a normal shampoo. So the summary, the good practice for you to have a good practice with regards to infection control, very simple. You have to have written protocols for the procedures like wound dressing, cannulation, blood drawing, all that infection control measures. And you have to have good hand hygiene facilities at the bedside, at the practice, at the table, alcohol hand rub, and soap and water. And you need to have proper sterilization and disinfection procedures in your practice. And spill management should be perfect. Blood spills and also vomiters, stool, urine, and all that things to prevent infections spreading among the patients. because the unhealthy people can have more and more infections, which leads to more and more use of antimicrobials and more emergence of antimicrobial resistance. And then you have to have your cleaning, both instruments and environment, especially the stethoscope. In between patients, you need to wipe a little bit with some alcohol, your stethoscope. Otherwise, you will be transmitting infections. And good housekeeping, record keeping, documentation, and a good regulation in your practice. So thank you very much for your attention. Any questions? So questions can be answered at the end of the session. Thank you.